Good morning. I don't usually talk with a script, but it's the only way I think I can stick to 5 minutes. So I've been working in Botswana since 2004, and there are many stories that I could tell in these 5 short minutes. So I've decided to try to put you in my shoes from 22 years ago and take you on a little trip, sharing one ongoing project and the prior work that inspired it. So picture this. You're a young pediatrician, just a few years out of training, and you sign on to spend 1 year in Botswana helping to catalyze the rollout of the continent's first national antiretroviral treatment program. Botswana has invested heavily in the treatment of its citizens, but there are thousands of children who are waiting for diagnosis and treatment. Many of them come in looking like this. They're chronically ill, and many are truly suffering. But the medicines are nothing short of miraculous. And within a short time, you have happy, healthy children thriving on antiretroviral therapy with their happy, healthy parents. With the privilege of playing a role in successes like these, you can't stand the idea of leaving Botswana after just 1 year. And so you stay on for more years. And you stay on until your family drags you to Philadelphia. But when you come to Philadelphia, you stay connected with your colleagues in Botswana and many of your former patients. You get training in epidemiology because Penn has a great program for that. And together with your friends in Botswana, you begin to study some of the questions that are important for improving the lives of children with HIV. Then, fast forward a few more years, many of the children that you quickly grew to love in Botswana continue to thrive. But too many of them, as adolescents, are deciding that they no longer want to take their medicine. As a junior research scientist, I got my first NIH grant to explore the reasons why many of the adolescents were beginning to struggle, how we could best identify those who were likely to struggle before their problems occurred, and how to best support them. One of the common reasons for not taking medicines really surprised me. Some adolescents who were born with HIV were telling us that they could never succeed in school. And as they failed out of school, they lost hope for their futures. We knew that children affected by HIV frequently have cognitive challenges, struggling with issues such as less working memory, slower processing speed, and more difficulty sustaining attention. When these challenges aren't recognized, the children are labeled as lazy or poorly behaved and blamed for their performance lagging behind their peers. But with identification of their strengths and weaknesses, these young people can be supported to maximize their strengths and progress towards meaningful long-term goals. Thus, the Ntimoha study was born. Ntimoha is a Setswana word that has many meanings. It means cognition, but it also means know my needs, motivate me, take me seriously, know me inside and out. All of the phrases that you see here in this word cloud. It's challenging to understand a child's cognitive strengths and weaknesses in a setting where there aren't yet culturally adapted and validated assessment tools that can be administered by available professionals. Thankfully, by the time my colleagues in Botswana and I became aware of the need for tools to better assess cognition among HIV-affected young people in Botswana, Dr. Ruben Gurr, pictured on the top in the middle there, and his colleagues at the Penn Brain and Behavior Lab had already been working for decades on developing a computerized neurocognitive battery, or CNB, that could allow for understanding of how an individual's brain works through game-like online evaluations. Through a grant in collaboration with Dr. Cobb Scott, pictured below Dr. Gurr, we were able to culturally adapt and validate the Penn CNB to allow for its use in Botswana. Now, with the support of the government of Botswana and the Penn Global Engagement Program, we're working with the Ministry of Child Welfare and Basic Education in Botswana to train and deploy a group of local psychology and educational professionals who are using the PennCNB and will now be able to assess students who are struggling in schools throughout the country. Using implementation science and quality improvement methodologies with our colleagues in Botswana, our next steps are to pilot and improve strategies aiming to support as many children with neurocognitive challenges as possible throughout the country, helping them to reach their potential. We're excited to see where this partnership goes next. Thanks.